wherever you're joining us from. We're just going to give it a couple more minutes for people who might be joining us, where people coming from shift and things like that. But if you want to put your camera on, we'd love to see you. We like to look into people's eyes. And also, if you would like to into the chat and let us know who you are, where you're joining from, what your background profession is, that'd be great. It's just a nice way of getting to know people who are here. Welcome. You're joining on the faculty tonight as well, which is great. If Daniel, if you just wanted to add in the year you are on the MSc and what your background profession is, that would be great. People will be able to see that and direct their questions to as we go through. Andrea, Michael, great. Cameras on. Love to see you both. I can see some rotors in the back behind you, Andrea. Getting everyone in control. Welcome, Robert. Yes, from Germany. That's fantastic.
Andrea, great to put a face to your name. Welcome. Thank you for putting on your camera. Michael, thank you for putting on your camera too. Where are you from, Michael?
Is joining us from Italy, which is fun.
From Lebanon. Vile, lovely to, I hope, see your face soon. And I'm sorry about the delay in your starting with us. I hope things are sorted out and you contact me as soon as you need. And welcome, Mustafa.
Super. We're going to get started for the evening. The plan of the evening is we're going to have a very intro by Tim, who's just going to sort of have a quick overview of the MSc for those of you who aren't so familiar with it, or maybe need a recap about the different elements and what happens over the years, so that you're on the same page as everybody else for that. And we've got a few students who've joined us, which is great, and so they introduce themselves a little bit of what they've been up on the MSc. And then for them, but we'd love your questions for them as well. So if you've already done the MSc, if you've shown an interest, haven't converted yet, questions and want to know, then do pop them in the chat, and we our students and ourselves will be able to help answer those, hopefully, and make you realize why you couldn't possibly miss out on this opportunity of a life to come and study with us at Mary's. So I'm going to hand to you, Tim, to start off with, please.
Libby, thank you for the introduction. I just saw Manuel's joining us from the DRC, which is a first. So I was just welcome. So, ladies and gentlemen, thank you for joining us tonight. It gives me great pride to introduce our master's programs. That's programs plural. Most of us are here to learn about the emergency and resuscitation masters, which is now really quite well established. We've recently added a tactical military austere and operational medicine masters, and of course Tessa's pediatric masters. We're not focusing on the peds today. We're going to focus on the adult programs. So Queen Mary is part of the Russell Group, which is the most prestigious group of universities in the UK. Things like Imperial, Oxford, Cambridge, Bristol, Exeter, and so on. Queen Mary is a huge university. We've got over 27,000 students from 160 countries. So wherever you're from, you're not going to be alone. It has a very strong track record, both in research and education, and that's in a London and in a world's standing. And that building you can see on this slide, that is the Blizzard. The Blizzard is a unique place. Under the ground, we have our scientists, and then above the ground, we have our clinicians. And this is an area that combines education, lab research, translational research, and clinical research. And that makes it a very exciting place to work. from the lab to the patient. So we have a large international faculty, most of which are kind enough to give their time for free. We have a smaller core faculty, which consists of myself, Ben, who is the academic among us, Tessa leading peds, Paul representing cardiology, the military, pre-hospital care, Libby with a strong background in education and a PhD in simulation, Stephen Thomas, who is now in the top 100 academics worldwide, Chet, who's on leave for a little while, and Daryl, who has a strong interest in toxicology, snake bite, and is an emergency physician out in Queens. So why would you want to study emergency and resuscitation? Well, I guess for those of us with passion for the field is, how could you not want to study the most interesting field in medicine? There's a reasonably large group of us in the emergency medicine field that see resuscitation arguably as a subspecialty, just as we might see toxicology or ultrasound or mental health or leadership as a subgroup or subspecialty in emergency medicine. It's only about 1 in 200 patients that need resuscitation, but that's where the risk is. And they take up a hugely disproportionate amount of resources. And you need a lot of training that goes beyond your basic emergency medicine or critical care or anesthesia or acute medicine or acute surgery to really excel in this area. I did fellowships in each of those specialties, and this master's really distills what I got out of those fellowships into a single 3-year program. The Module 6 and 7 of the basic course have been adapted for tactical, military, austere and operational medicine by Paul Rees. This is in place of the ultrasound and is an extended toxicology module. And this is a separate master's that shares 80% with emergency and resuscitation. This is aimed not just at military docs and paramedics, but those that may want to work in harsher environments, the Arctic, the Antarctic, oil rigs, those of you that might want to do advanced rescue work, or those of you that are simply interested in doing aid overseas. We do have a huge faculty. Up there, you'll see Chris Carbull. Well, you'll see Libby first. Chris is Professor of Emergency Medicine at Harvard. Brian Burns, who you'll know from Life in the Fast Lane, and Resusme, Associate Professor of Emergency Medicine in Sydney. We can then see Gareth Davis, who set up London HEMS, Maurizio, who was ex-president of Intensive Care Society for Europe. Chet is over to the left of him, and then we can see Barbara Bacchus, who set up the Heart Score, and so on. Now, we set this program up very much as interdisciplinary. The idea for the program grew very much out of HEMS. One of my jobs in HEMS was dealing with professional standards and training, and it became really clear that a lot of the HEMS paramedics were incredibly motivated, and a lot of the HEMS doctors and nurses were incredibly motivated to learn, but really there wasn't anything out there. The masters that we found were out of date and didn't really focus on resuscitation. So this idea grew out of HEMS teaching and rapidly expanded into emergency medicine and critical care. We welcome paramedics, nurses and students from all over the world, as you can see from the graph that Libby kindly prepared for us earlier. Now, this is entirely online. Wherever you are in the world, you can study with us. We release 3 to 6 lectures, or perhaps more now, lectures every week. And generally, you're going to need somewhere between 2 and 6 hours of listening to those lectures. We meet on Thursdays for a dedicated tutorial. We have some case-based discussions later on a Thursday, which run across the years. Years 1 and 2 each consist of 4 modules, and each of those 4 modules consists of 8 weeks. And in year 3, you'll do a scientific paper. That is, you will aim to produce a paper for publication of around 3,500 words and a conference standard presentation. We changed away from the dissertation because we wanted you to have something that was useful for your CVs. We run a summer school, which is put together and very well run by Libby. This looks at human factors, simulation, has some dedicated lectures, some skills tutorials, and an ultrasound course. In year one, we focus on the more general aspects of resuscitation. We start looking at the fundamentals of research. We move on to look at the physiology of shock, the foundations of resuscitation. We then get into the very meaty stuff, cardiac arrest, analgesia, sedation, and we end year one with a more general look at the background conditions that lead to organ failure. In year two, we focus a little more on special areas. We go from trauma to diagnostic imaging to toxicology, and then to a choice of either pre-hospital or pediatrics. We welcome students from all over the world, and as the Masters has progressed, we've welcomed students now, I think, from every continent except Antarctica, although one of our ex-students is currently in Antarctica, so I think we'll put that on the map as a semi-guess. So what do we want from you? Well, generally, we aim at people that have got 5 years experience overall. Now, that experience is clinical and differs a little from doctors, nurses, and paramedics. Paramedics often spend a lot of their time in training, so paramedics will often be able to join us in their first or second year after graduating. For nurses, we really like you to have spent some higher training time in critical care or emergency medicine, or both. And doctors, we generally like you to be have got through your first 2 years. Quite simply, doctors joining in the first 2 years will not have enough clinical exposure to critical illness to really benefit from the course. And just as a rough guide, I think the average age of paramedics is somewhere in 40s, but falling. Doctors, we have a range of consultants down to core trainees, and nurses, we've had some senior nursing managers in their 50s down to nurses that are just beginning their resus career in their 20s. So it is a hugely diverse age and culture range. For assessments, we always use multiple choice to assess core knowledge, but we then supplement that with the bulk of the assessments either being a written assignment, because you need to learn to communicate in writing, presentations, because for most of you, you will communicate your knowledge not as a scientific paper, but in teaching your colleagues. And the most common way you teach colleagues is with a presentation. And in year 3, as I said, we bring in and look at a scientific paper. Module 1 also includes some dedicated critical appraisal time, and that's so you get to practice what we've taught you in module 1, and you can learn to take apart papers, because this is level 7 learning. Level 7 learning is all about you forming your own ideas, your own opinions, and then communicating those ideas and opinions to your colleagues. That means you need to be able to read papers, sort out the papers that are going to influence you because they're well done, they apply to your patients. And so we start very much with that background of science in mind. So I'm going to thank you very much. I'm going to encourage all of you to follow your dreams wherever they are. I'm going to hand back to Libby, and I'm going to look I'm looking forward to hearing from Libby and our students. So I'll stop sharing my screen. Thank you again for being here.
Brilliant. Thank you so much, Tim. So eloquent as always, and the inspiration behind all of this. And see, so we've got an extra, I'm going to be from Antarctica on the course, but we do have Daniel from the air. He's in critical care transfer, one of our students. So I think, so you can do tutorials anywhere, anytime, depending on what else is going on. And we haven't had people joining from the air before. So great. My name's Libby Thomas. I'm an A&E consultant in South London, but my interest is healthcare education and simulation and things like that. And so I sort of work really with the MSc program as part of the faculty, but also to work with you all and trying to improve the experience for the students and do things like the summer school that's been mentioned already. We've got another key member of our faculty on the call this evening, which is Chris. Chris, are you happy to say hello very briefly? This would work without you.
Of course. Hello. Yeah, if you've applied already, you may well have corresponded with me, and obviously the current students should know me well. So I'm here for all of your logistical needs, administrative questions, etc.
is an absolute star, and she will be the person who is dealing with correspondence along the way. So we're joined by several. We've got 3 paramedics. We've got Daniel, who's one of our doctors, and we've got Josie, who's one of our nurses on the course. I'm going to go to Daniel first, mainly because he's in the air. He's in mid-critical care transfer, and there is a chance that things won't be going smooth and he won't be able to be with us for much longer. So just ask each of the students. We'll start off by telling you a bit of background of who they are, why they're in the MSc, and then something what they what out of it or doing their work and things like that. And we'll start with that. So Daniel, if you're able to talk, we'd love to come to you first, please. David, can we pin the person who's speaking, if possible? Daniel, can you hear us or not at the moment?
Yeah, that's fine. Let me just move so that at least some. Okay, great. You can hear me? Yeah. Okay. Great.
Daniel, I think you just muted yourself. We could hear you say yes, great.
Oh, there we go. Sorry. Yeah, my thumb is a bit thick. Yeah. So my name's Daniel. I'm second year now, master's student. As a background, I'm an emergency physician. I'm a consultant emergency physician. I've worked in quite a few places, Mexico, Israel, and most recently in the UK. I've been there for 1 year during the, I was one of the resource fellows as well. Yes, as Libby and Tim said, I'm currently doing a neuromedical transport of a patient who's intubated and on invasive blood pressure. So that's why I'm looking at the monitor all the time as well. So if it cuts off, I hope everything's stable and everything goes well. But what I wanted to tell you all is that this is an amazing master's degree. I've really enjoyed every single lecture, every single discussion. And what's amazing about this master's degree is the interaction that you have with all the faculty. You get to speak to them. They basically become your friends. You chat about all of the different cases that you've seen. They bring cases. There's a lot of discussion. And it makes for an amazing interaction that you'd very rarely see in any other master's degree, even though it's online. The interaction that you get is on par with the most sort of intensive in-class sessions that you could have. And I've really enjoyed that. And the faculty are amazing. Tim has done an incredible job at organizing this master's degree. Just recently we've done the summer school, which Libby organized, and that was superb. We had so much hands-on practice on ultrasound, on resuscitation. We did amazing simulations. So I mean, I can't recommend this enough. Really, I love it. I mean, I'm only starting the second year, but I'm afraid of the day that this master's going to be over and I'm not going to have access to the amazing lectures, to the amazing faculty. So to be completely honest, I'm really excited about it because I am. I cannot recommend this more, to be honest.
Super. Thank you, Daniel. And just while you're on the line, you've come to us with experience, found the mix of international people that we have on the course, both from faculty and from the student perspective.
So, I mean, there's an incredible mix in terms of skills, in terms of backgrounds, in terms of sort of, we've got nurses, paramedics, as lecturers, as faculty, as students. So it's great to be able to have that mix. And sometimes you don't realize that a subject is not very clear in your mind until you get to sort of speak to a paramedic about it and really describe it. And then suddenly you realize maybe my ventilation skills are not amazing because I wasn't able to explain it properly. And this is what is also great about this master's degree, that you not only speak to people on your level, as you would in sort of a normal classroom. You've got paramedics, you've got nurses, you've got consultants, you've got sort of registrars or residents. So that gives you a great opportunity to actually not only learn, but also test your knowledge by imparting the learning that you have to other people.
So thank you so much. I promise I'm not paying anybody to speak today. That was very nice. Just about covered from summer school. We'll give you a chance to look more carefully at your patient for a few minutes, Daniel, and we'll move on back to you. So I was wondering if we can come to you, Charlotte. Maybe you'd just like to say a few words about who you are and what you've about this.
Hi, I'm Charlotte. I've just completed the 3rd year. I hope I've just completed the 3rd year. I've also thoroughly enjoyed this master's. It's been really useful in terms of upping the day-to-day knowledge that I've used. I still work just frontline as a regular paramedic. So a lot of the knowledge that we get is a really nice to know, and haven't got to the point where I'm going to be utilizing it in the job. But what it does is it's really nice to it gives you a much better understanding. And there have been lots of tricky bits where it's been aimed at, I think, maybe a doctor level, and you find them caught up. But as Dan said, the faculty are actually really amazing, and as soon as you ask for that extra help, it's really given. So I did the master's because I wanted to progress clinically, and I think this is a brilliant one to give you the knowledge to be able to then apply to other jobs to do that. It covers a massive range of topics. And as Dan said, some things that we're taught, I think we as paramedics get a lot quicker than some of the doctors. I know that when we did a bit of a debrief in the summer school in the first years, there was this kind of a moment where the doctors looked and went, huh, I never really thought about that from your angle. So the interprofessional learning is really good on a lot of levels. Some things I think we take for granted clinically that the doctors then don't think about, and vice versa. So it can be a bit daunting in the tutorials if you're coming from perhaps a lower knowledge background, but actually I think things are explained really, really nicely for all levels, and I think there's a lot of effort made by all of the faculty to be really inclusive. So that's a really positive thing. It's hard gearing a master's, I think, for 3 very different education levels, but actually I think it's done really, really well.
That's cool. Thank you. I think the interprofessionality is a challenge, but actually I think we hope it brings a good enough dimension. And at the end of the day, none of us work in silos. We all need to work from the pre-hospital to the intensive care continuum. What we really want to do is that journey part of the MSc, make sure we are from each other. There are certain parts of the course which feel a bit more geared towards certain groups within, but hopefully people get along by everyone within the group, and they help each other. As Daniel said, he found himself trying to explain to other people, but vice versa. In the summer school, we learn so much from people who work in a different environment to the rest of us, which either way, whichever it happened, there were some hilarious moments this year. We had an ambulance this time, sorts of other stuff sort of raised to another level. Thank you, Charlotte. I'm going to go to Johnny. You and Johnny actually work together in the England, so you've got that sort of community built in, and there's a few people who come on this course who got colleagues at the same time. But can you tell us a little bit about yourself, maybe about the community of and things within the course.
Yeah, I can just reiterate what my colleagues have said here. And yeah, like you said, Libby, so taking us backwards, I'm Johnny, paramedic, same sort of cohort as Charlotte. So we've just submitted our final project and hopefully we'll be graduating later this year. But as you say, I worked with Charlotte originally, and we were both looking for masters and decided that that would be a nice support network. And that has been fantastic, but it's been fantastic having someone who you know and work with. But also we've just met we've met virtually some really, really interesting people across the professional spectrum, which has been great. And we have a sort of informal WhatsApp group with the majority of the cohort, and it's been really useful because as sort of relationships have built on, it's been useful for me as a paramedic. I've put in there a couple of times now, I've taken this patient, I've just seen this patient. Can you guys tell me a bit more about what will happen? What do you think the likely clinical course is? Because you built up that rapport. And So that's been great. I joined because I wanted to develop clinically and build my clinical knowledge. And I think that certainly has happened. And I know now that although I can't perform the skills, I'm working as a, standard scope paramedic. I'm certainly thinking about jobs differently and having that insight into ultrasound, for example. I'm not doing ultrasound, but now I've got a much better understanding of what it can be used for, what my critical care colleagues can be used for, and a better understanding of what my colleagues what the path for the patient may be. So I'm definitely thinking about jobs completely differently. Well, not completely differently, but at a more advanced level. And what I've got out of the course is that I've now moved into an educational role as well, which I certainly wouldn't have been able to do without this course. So I've certainly got a lot out of the course. It's been great. And actually, now that I've finished the course, I've just started referring back to the videos and watching them again, which has been really useful. And I've found for me that flipped learning models worked really well. Working shifts makes it difficult to attend taught sessions. And I originally thought I'd benefit more from a taught master's, but just couldn't because of the timings. But actually, I've benefited a lot better from this because some lectures, aren't particularly new to me, so I can watch them in real time. Whereas a lot of the lectures were introducing new concepts and I could pause, read, come back to it later, maybe go watch a YouTube video or something else, and then come to the 1 hour live lecture with these amazing people and actually come in with questions. And it's worked really well for me. And the faculty have been amazing. And what's really impressed me as well is just the external people, the breadth and depth of knowledge has been amazing. So I wish you all good luck and I'll be here to answer any questions.
Thank you, Johnny. And that sort of partially answers one of the questions, Brown. It's all the lectures are recorded, but we have other content. We're starting to build podcast content, links to other things. So you watch those in your time around your shifts, and then we have a weekly tutorial, which always happens Thursday. Time will vary depending on the module. It's usually 11 or 1 o'clock, whether it's GMT or BST UK at that time. But what we do is really encourage people to recognise this always happens on Thursday. So if they get their shifts and get that time made more readily available to attend on a Thursday, then that's really, really encouraged. And actually what we really like is the interaction on a Thursday. People come together, hopefully some of the content haven't always, sometimes they're a bit more me. Oh, I meant to get time, but they still want to learn and listen, ask those questions, listen to everybody else talking. And what's really important to us is building a community of students. So actually you can only learn from others if everybody has time to try and tutorials part of that sort of wide learning circle. So the more we see your face, the more we get people up, then the better for us and the more enjoyment we get out of it as faculty. As Tim always, we're constantly learning the whole time. We also use our WhatsApp to go, oh, okay, so that, they do responding to X, Y, and Z. What would anybody else do? You have this automatic group of experts around the world that you can call on, which is fantastic. We do go back and rewatch the videos. I think you have to work really hard over the next couple of months, John. You might lose for another few, but I wouldn't go that route at all. So you do have access to all of those for a while. I'm going to go now to Josie, joining us from her phone, but hopefully, and certainly her mic on, and she's one of the nurses on the course, and she's hopefully going to have a quick chat about her journey on this. Able to join in, Josie. Awesome.
Hello, can you hear me? Oh, amazing. Apologies. I'm kind of just run away from the shop floor and I'm in the sister's office, so it's a bit of a mess in here, but apologies. So hi, I'm Josie. I'm one of the A&E sisters in Brighton, and I've just finished at the same time as Johnny and Charlotte as well. We've just submitted our final project and we're all got our fingers and toes crossed that we scrape past at least. I think I missed the first beginning bit of what you wanted us to talk about, Libby, but I'm guessing that we're just talking about our experience on the course and what we found useful and how we have used the course. So yeah. I've been an A&E nurse for a decade now, which is terrifying. And I've worked in A&E the whole of my career, basically. I did a bit of resuscitation stuff with the Resus Council and ALSG, and then have moved into an education role within the emergency department since the beginning of the pandemic, essentially, which coincided with the start of this master's modules. Initially, I found it really, really tough to balance that sort of work-life balance, trying to get the videos watched, and there's, you know, several videos to watch throughout the week, and then you've got the tutorial on Thursday, and it always seemed like Thursday was the next day. Every single day of the week seemed to be Thursday at one point. But I think that was also a symptom of the pandemic, and it was, you know, just trying to work through a pandemic and try and study at the same time. I definitely, once I'd sort of cracked the first few modules, I found it easier to get into a bit of a rhythm with watching the videos in advance through the week. And sort of a lot of them are quite short. And I think if you sort of look at the time length of the videos, you can kind of get a bit more of an idea of, you know, I've got 20 minutes here, I could watch that one. You don't necessarily have to watch them all in order, and sort of try and get through them that way. The tutorials are incredible, as my colleagues have just said. You've got this amazing world leaders, experts in all these sorts of fields, and Tim and the faculty seem to pull out all sorts of weird and wonderful people from the woodwork to talk about snake bites, and then you're talking about, you know, helicopter transfer medicine, and then the next minute it's about altitude medicine. You know, everything is covered. It's just an amazing course. The support through the third year is equally fantastic. I've had regular contact with my supervisor. I've had loads of opportunities to touch base with them and explore how to do my final project, which was really daunting because I'm just a nurse, and I don't do research projects because I'm just a nurse. How could I possibly do a research project? And it's that sort of imposter syndrome that we've all got to overcome, I think. And to be able to have that support and regular contact with the faculty has been incredible. I think from a nursing perspective, the bit that I found the most challenging was the imaging, a bit like I think the paramedics have just said, because I don't do ultrasounds on a regular basis. And I was looking at these echoes and I'm like, oh, I'm never going to get this. And actually, because we have such incredible teaching experiences from the faculty, by the end of it, I feel really comfortable interpreting those images, even if I'm not going to perform them myself. If someone shows me an image, or if somebody talks to me about a CT scan, I'm able to understand exactly what they're talking about, even though I haven't performed it myself. So exactly like Tim's just put in the chat, you know, the same standards are there for everybody, whether we're the ones performing the ultrasound ourselves or not. To be able to understand and interpret it are just as valuable. And I think, you know, if I was to go on and do an extended role, to have that baseline knowledge to go onto an ultrasound course is just fantastic. And obviously for the medics on the course, I think are able to, you know, then go and do their practical skills much more confidently because they've got that underpinning knowledge. Yeah, I guess that's all I sort of prepared to say, Libby. If there was, I'm happy to take any questions. I'm particularly happy to take any questions from nurses that are worried about maybe do a master's that's not aimed at doctors. It's not aimed at doctors at all, but from a nurse's perspective, I'm more than happy to chat through things. And yeah, I wish everyone luck with their course.
Thank you, Jason, so much. First of all, there's no such thing as just anything. We are in all integral parts of the system. None of us could do it without the other one. So you are definitely not just. So no more of that. Oh, what was I going to say now? There was something about that. Oh yeah, so one of the things about the summer school is we run this year we managed to increase it to 2 days of ultrasound training. So those who haven't got any ultrasound exposure, if you come to summer school at the end of year 1, then you'll get that ultrasound exposure before doing module 6 in 2, which would really be on a good start. Split the ultrasound training into 3 parts. So there's 3 levels. Basically, there's 1 level for never picked up a probe at all, never engaged in any science or anything like that. There's a level for those people a little bit of ultrasound, maybe had a sessions here, but not engaged in it extensively. And then we do advanced ultrasound for those who've done their basic work and really want to push their skills and go on echo and abdominal and other areas. So we're trying to make sure we tailor it to everybody and give everybody opportunity in that. Our final student wasn't able to talk the first 15 minutes or so, but hey, Neil, yes, I can talk on. Is Neil Jones in the UAE. He's one of our joining us from abroad, but he us for summer school, end of year, end of his first been. And because actually we get the students through summer school as well as the online tutorials, and one thing people have picked up on is that they find it much easier to interact with tutorials. They've been to some of those friends and it feels a little bit less daunting than it might do otherwise. So thank you so much for joining us, Neil. Are you in the UAE or are you somewhere else? Because you always seem to be dashing.
Hi, Libby. Yeah, I'm currently in Egypt with work at the minute, so the Wi-Fi is a bit hit and miss.
There we go. Thank you for joining us. I'd love to hear about your experience of from abroad, how this is your work, and the sort of challenge you made. Well.
Yeah, sure. So, hi everyone. My name is Neil. I absolutely hate public speaking, so thank you, Libby, for tonight. I started as a paramedic in Manchester. I worked there for about 6 or 7 years, and then I moved over to work in the United Arab Emirates. And I've been here now for about 8 years working as an advanced paramedic. I suppose I just want to say to people that when you join the MSc, we've all got personal reasons for joining the MSc, and we're all joining because we want to be challenged. This is a choice. So it is really a personal investment in yourself. So if you want to get everything possible out of it, you'll commit from the start. And I think that's one of the most important things I can say is from module 1, really engage with the tutorials. Start watching the videos early. Don't let yourself fall behind. Block time so you can watch the videos and you can start planning ahead then for when you've got to start looking at your assignments later on in the module. So time management definitely is key. For me personally, module 1 is fantastic. Again, it's challenging, but we want to be challenged to learn. But Ben Bloom headed up module 1, and it was really about understanding critical appraisal of papers. And as a paramedic, I used to kind of pick up a paper or journal, skip to the conclusion and go, okay, that's what they're telling me, that's what I'll do. But what Ben actually gives you in that module and on the other faculty, to be fair, is the real skills to, yeah, that's the conclusion, but what's the area under the curve? What's the p-value? All these big words we read and skip over. You actually get a fundamental understanding of what they mean. So you can read the conclusion and go, yeah, they're telling me this, but after I've read the paper, I don't agree with you. So it gives you that skill, which is really important, I think, if you're going to develop in the future. So yeah, if you want to stay up to date with current best practice, for me personally, working overseas, the scope of practice is much bigger than in the UK. So I learned a lot in this course in terms of RSI, milrinone, medications for raised ICP, and also things, if you're working internationally, it's very heavy on the American Heart Association and ITLS and trauma training ATLS. And because them updates come out every 4 or 5 years, varies, what you're currently being taught may be 3 or 4 years old, such as if someone's got a raised ICP, hyperventilating, reduce the end-tidal CO2 to reduce ICP. The latest research is suggesting we shouldn't be doing that. We should be going for normal CO2 levels. But if I hadn't been on this master's, I wouldn't have had my eyes opened to the current best practice. So yeah, there's my thoughts on the matter.
Yeah, and thank you so much, Neil. More public. Is it?
Cheers.
And one of the things we tried to do, of course, MSc is to develop different skills. You have the documents vary, some about writing essays, some of them about short answer questions and critical appraisal. Some are actually about recorded presentation, so it's doing an oral presentation to present your answers and fitting that 10-minute slot. So develop these skills, because what the vision is you go away not only with your own increased knowledge, but you go away with a passion for the subject that you can impart and share with other people. You can become an educator, like saying he's getting involved in education now since he's been involved in the MSc, or you can become academic and go down a research line. You've in your year 3 and your child dissertation so much that you realise that's the area you want to pursue. And what we want is you to be leaders in the field all over the world and to have these connections and these people that you can call on in order to continue to develop yourself as well. Tim, you have a chance. Do you want to take a minute?
Libby, thank you so much. I've been trying to answer some questions in the type. I'm going to just verbalise a couple of the points that I've made. So one of the questions was about how this masters differs from the masters in, say, Sheffield and Manchester. Look, both of those are absolutely superb, but they're looking at emergency medicine as a process, and they're really designed to introduce you to UK emergency medicine. We focus on resuscitation. So we focus on critical care medicine, whether that's delivered on the wards, in the ED, or pre-hospital. So we don't really cover things like minor injury. We certainly cover sedation, procedural sedation and analgesia, but we're not really here to teach you how to suture wounds, assess minor fractures or minor sprains. And we're not really here to teach you about the general structure. We are predominantly a clinical program, and our remit is to help you become the best clinician you can for the focus on critical illness. So I hope that's clear. If any of you want me to talk more on that, please either pop up your hand. I can see Jerome. No, sorry, that was my own marker, not Jerome's hand. I'm sorry. Andrea, was that putting a hand up, or was that no?
So, Charlotte, you said you dedicated one full day pieces around that on other days in order to balance the work and life. Neil, Daniel, how did you do it? How did you make it work for you? Got any tips?
Hi, Libby. Yeah, so I worked slightly differently. So depending on the module, I just tried to work smart. So if I knew that the proposed question for the module was around a certain topic, say TBI, I would kind of look where them particular lectures were throughout the 8-week course, and I'd try and bring them forward a little bit. So I was critically thinking about how I'm going to structure my assignment later on. And then I'd also try and keep up with the weekly ones, so I was able to participate in the tutorial. But I didn't say if I saw a bulk of the topic that, you know, for my assignment was in week 5 or 6, I didn't wait to get there. I kind of managed my time and moved them around to suit me a little bit.
During a weekday, or did you?
Yeah, I can't study for 8 hours because nothing goes in. So I tried to do 1 or 2 hours a day, Monday to Friday, 5 days a week.
And how many hours do you think you would needed to put in, Neil, on average?
On an average week, 6 hours, depending on the volume. Sometimes if we're talking lactate, Tim, it's a heavy week, but it depends on the topic.
Nothing
so
better than lactate.
Johnny or Danny?
Just like Danny might be otherwise engaged, I'll pop in quickly and just say.
So I'll go after you. No worries.
Also, for me, Charlotte and I have very different approaches, and it was great having her on here actually. She's much more coordinated than me. I sort of would watch mine as and when, which was really handy actually, because that worked for me. When I'm feeling productive, I could just watch loads of lectures in one go and be ahead of myself. Or I could just watch them as I went. For those of you on the paramedics, if you're fortunate enough to be on the RRV line and get some downtime like I was in my first year, it was great being able to watch them on night shifts. But yeah, I found that it just worked really well for me, having that flexibility. Sometimes I'd watch 20 minutes a day, sometimes I could watch 5, 6, and I really liked having them all. As soon as the module opened, they were all there for me. And there's nothing to say that you can't skip ahead. And that is actually quite useful. You know, if you've got time, you can skip ahead and then free yourself up with more time for the assignment. So I found that flexibility worked really well for me. Over to you, Dan.
Yeah, I mean, I've actually tried a few different things along the as the year went by. I think that one of the things that the MSc actually taught me is time management, because I am sort of I don't know. I think as an emergency physician and interested in resuscitation, I like the stress. I like the last minute pressing on and getting things done. But I mean, it's not very compatible, and you don't get that much out of it. So I've actually switched to sort of trying very early on to look at the lectures, trying to even maybe get ahead of the lectures, and just so I know what I'm doing. Some lectures, when I realize that I know the material quite well, I fast forward a bit or put it on sort of 1.5 times speed, 2 times speed. go to the material that I really want to actually go over and really study. And I sometimes stop the lectures, go into sort of some of the papers that have been listed. And that's basically it. In terms of the assignments, I was also doing that. I was procrastinating until the very last moment. I don't recommend that at all. Sort of look at the assignment just at the very, very beginning. And once you know what the assignment is and you've had a chance to think about the assignment, as you go through the lectures and as you go through the tutorials, you start getting ideas of how to attack that assignment much better. So my recommendation is like really work on your time management skills. Don't procrastinate, and really try and take advantage of the amazing lectures and really rewatch them. If you find that something is not very clear, rewatch the lectures. I was watching them on my commutes as well. But I mean, for everyone, everything, you need to figure out what works for you and take the first 2 modules to really try and figure out what works best.
Thanks, Danny. And I think the thing that there is the moment, so it may be, say, on brain injury, on a concentrated degree, but there's all CQ for every single module, and drawn from across all of the lectures. So it's not that you can just concentrate on the one thing in the written aspects, you do have to do MCQ as well. And it's tried to be written in a way that ChatGPT wouldn't answer for you, but you have to watch the material and interact with it so you can actually know what is. We have started to develop a lecture down option, so we make it better for people to offline, but really clunky. It's something that's been continuously asked for by the students, and we're continuing to work with Queen Mary's on this because obviously times are changing. I want to maybe ask the guys, where's the strangest, I mean, Daniel in the air at the moment mid-critical care transfer, but where are the strangest places or you never get to watch lectures or join tutorials from over the last couple of years?
Well, for me, I was from the RRV, and I found that nice that you're working. You're in basically. Sometimes you'd find Charlotte and I would often comment, where's Tim going to join us from this week, or Ben, etc. Because it would be sometimes you'd be at the back of the hospital, and that's nice for us to be able to see that our colleagues are also actively working, and that worked really well for me. It was really nice, with I guess meetings outside of this environment, people expect you to be fully engaged, and of course we want to be there for the whole thing, but it was really nice that you could just join. You might join 10 minutes late and you guys would know why, or if we had to dive out 10 minutes later, that's completely understood.
Being on shift, so people who need to get their break, if and try and get at least for half of the tutorial, or people joining from ambulances. And our is a rapid response vehicle for those outside the UK. So a paramedic working alone at an advanced level who can get quickly to support the paramedics or other crews at critically ill patients and things. So they have that from there. A lot of that, and sometimes we want to do break groups. Who's going to be able to interact and who's going to disappear? So allocate the breakout groups. Well, there's at least 2 people who can interact in each group rather than people who are middles and not able to sort of stand up and get. Neil's watched some lectures from the bath, and I was expecting that to come out. So that I don't think Charlotte probably, she's far too organised for the rest of us. We said people joining from on holiday sometimes, people joining from airports, people joining all the places, and just trying to fit whenever they can, which is great.
It's worth adding that that's why the Masters is over 3 years. When we were planning this, most Masters are 1 or 2 years, but it's really clear that if you work in acute care, that's just not going to work, because there's weeks you're not going to be able to join us and weeks you're going to have more downtime. So for those of you that are wondering why is this 3 years, you are all the reason this is 3 years, because you all work.
And everybody on this is working, so everybody's working pretty much same time or doing a teaching job or something else alongside doing this Masters. It's a full-time program. Try to make it doable. You can't do the over 3 years anyway, Johnny, so this one anyway. Right, it's nearly 7 o'clock to 7, so any questions haven't been answered from those of you who've joined us. It's been great to have a whole group of you from all over the world, literally, which is fantastic. Chris, anything you think we haven't said?
No, I don't think so. I mean, there's such a kind of like vast array of questions, but I saw that someone had asked about funding, and there isn't an awful lot available, to be fair. So the main funding is the Commonwealth Scholarship, which is for students from lower middle income countries, and you have to be a national and resident in a lower middle income country, and it's the Commonwealth that determine which those countries are. That opens normally in the spring each year, with a closing date of early May, for example, if that's relevant to you. We do have one of our new Commonwealth scholars on with us here, which is great. Great news. Congratulations, Jerome.
Welcome, Jerome. Another thing, Chris, is about who have signed up to sort of they finish converting or when they need to let us know that they're definitely joining us in September.
It's as soon as possible, really. And the university is always obviously asking us to get people through. So if you haven't accepted, if you've got an offer and you haven't accepted it, I'll likely be emailing you very soon to sort of chiver you along a little bit. We just sort of want to have an indication of who's going to be here and start to kind of give you information about what to expect. It's further to what you've received here, really, so you're prepared for the start on the 18th of September is the start of the new academic year, FYI.
Super, thank you, Chris. Thank you for Johnny and Charlotte for about their funding there. And some people, you know, you never, if you don't ask, you might get funding. You know, you tell them you're going to be the leaders in emergency medicine, resuscitation, or in education, whatever it is that's going to appeal to your viewers. And some local charities and things are willing to help out as well. So if you don't ask, you get, is what I say. I just want to say thank you so much, Neil, to Charlotte, to Johnny, to Daniel, Josie earlier for joining us and telling us about their experience. We gave them ideas we'd like them to talk about, let them be completely free on today. So it's been really lovely. Thank you so much. Thank you, Chris, for all the amazing work you do from holding the whole MSc together. David, who helps us with communication, setting up these webinars and things like that, which is fantastic. And obviously none of this exists without who is the inspiration, the leader, and all going. So thank you so much, and thank you so much everybody for being here. Hope it was useful. Get in touch if you've got any questions. We're more than happy to answer them. And follow us as well. We're at Resus Masters, and then we sort of put other webinars and things like that. Put the links up on there. Super. Good evening, Debbie. Thank you.
Thank you all, Libby. Thank you for your superb chairwomanship, and I wish you all a great evening. Thank you, Libby.